So I'm Dr. Michael Majetich. I'm a family medicine physician at SOM Primary Care in Willoughby. So the terms cold and flu get used interchangeably a lot. Upper respiratory tract infections are the key symptom we see in both, so that's why it's so commonly used interchangeably. Both have, congestion, cough, but flu typically has high fever, body aches, sometimes headache. Those are some of the highlights of influenza. So when it comes to testing for the flu, most situations we diagnose it clinically, which means that you come in with the appropriate symptoms in a period of time when influenza is more prominent in the community. There are ways to test for influenza. A lot of times we can do a rapid test in the office through a nasal swab, which is similar to when we do a throat swab for strep throat. Usually we still treat it conservatively, meaning we have you treat the symptoms. You want to stay well hydrated, you want to treat the fever with over-the-counter pain relievers such as acetaminophen, ibuprofen, and stay really well hydrated. But there are prescription medications, most commonly Tamiflu, that when used in the first 24 hours, or when used in the first 48 hours of diagnosis, can reduce the symptoms by hopefully a day or so and make it a much more tolerable course. Great ways to try to protect yourself from contracting or getting influenza is to protect yourself by washing your hands, watching the people that you're around, keeping away from those who may be sick with upper respiratory symptoms or symptoms similar to the flu, like fevers, body aches. You want to make sure that you're not spreading it around as well. So covering your mouth and nose when you cough, typically by bringing your arm across your face, is a good tactic, but good hand hygiene and limiting your contact with those who are sick are one of the best ways to prevent this from happening.